And welcome everybody to the Lake Oswego Chamber of Commerce Friday Morning Networking, where we connect the faces of local business with our community and we help you to get your word out. As always, I want to thank you all for taking time out of your busy Friday to join us. Today, we're fortunate enough to have not one, not two, but three people from Clear Choice Dermatology. We've got Adrienne, Mark, and Taylor from Clear Choice as our hosts today. However, before we get to our hosts, I know we have some new people on the call. So welcome to you, Heather. It's always great to see new faces. And we welcome you all to this virtual networking session. We will give you an opportunity to introduce yourself and your business to everyone later today, just before we break into small groups. If you haven't been here before, so we're going to hear from our host, then we're going to hear from Liz, then we'll hear from our new guest, then we'll break into some small groups for a little more intimate networking, and then we'll come back for group announcements and raffle prizes at the end. So with all of that said, let's welcome our hosts today, Adrienne, Mark, and Taylor from Clear Choice Dermatology. The microphone's yours, Adrienne.
All right, I'm going to share my screen because we have a slideshow to go through. Is everyone able to see that?
Yes, we can see it again.
Okay.
That's good.
All right, we are Clear Choice Dermatology. We're a medical, surgical, and cosmetic dermatology clinic located in the Dalles, Hood River, Goldendale, Lake Oswego, Hillsborough, and Salem. All right. So I'm sure that this is the one that we're most concerned about today is our clinic in Lake Oswego. We're located on 123C Avenue. It's just about a block down from the Rite Aid. We're open Monday through Friday, 8 to 5 p.m. And our providers are Dr. Blattner, Mark Davis, and Taylor Pottratz, who are here today. I wanted to introduce Dr. Blattner. He's not with us today, but I'm sure you guys will meet him eventually. He is our double board certified dermatologist and our Mohs surgeon. Let's see. A little bit about him. He went to Arizona State for his bachelor's degree. He got his medical degree in Iowa, and then he did his residency at Silver Falls Dermatology. He has a pretty impressive background of training and experience. You can see some highlights here. He's done a lot of peer review publications. He's written a lot of textbook chapters, lectures, presentations. He's very intelligent, and his patients really like him because he's down to earth, really easy to talk to. Mark and Taylor, how would you describe him?
Yeah,
Ambitious.
Yeah, very ambitious. He's a young.
He's like Doogie Howser. He got through his undergrad in 3 years too. It's not on there, but yeah, I thought that was impressive as well.
Yeah, very intelligent, down to earth guy. He's ambitious with all of his offices that he's opened up already. All right. And then I'll just let Mark chat about yourself.
As you can see, I'm a relatively local. I went to school up in Northwest Washington. I grew up on the Washington side of the river, but I always say I grew up rooting for the Blazers. I grew up in Stevenson down the gorge. And I went to Rutgers for my PA program. I wanted to do something a little more exotic, and so New Jersey was very exotic for me. And they have an outstanding PA program, which I was proud to go to. I've always had an interest in dermatology, and the first part of my career I worked in orthopedic surgery, and have found myself finally doing dermatology, which has always been a passion of mine. So I'm excited to be here.
Awesome. And then we have Taylor.
My name's Taylor. I've been with Clear Choice Dermatology since July last year, so about 7 months or so. I went to Oregon State University in Corvallis, grew up in Oregon City, so been around the area for forever. Went to A.T. Still University in Mesa for 24 months, found my way back here in Lake Oswego, Oregon City area. I had about 3 years of dermatology experience before going to PA school, and then did a year-long extended elective in dermatology, and then have been with Clear Choice for the past 7 months. So yeah, dermatology is my thing.
Yeah, so Mark and Taylor work at both of our Lake Oswego and Salem clinic. And Mark works also at our Hillsborough clinic. Did I get that right?
Yeah.
Yes, yep. We're everywhere.
Yeah. Okay, so we offer medical, surgical, and cosmetic dermatology. Medical dermatology, just a quick run through, we treat all conditions that affect the hair, skin, and nails. Surgical dermatology, so one thing that kind of sets us apart from other dermatologists in the area is that we offer Mohs surgery. Dr. Blattner is a fellowship trained Mohs surgeon. There's only a couple Mohs surgeons in Oregon, so this is cool that we can offer this. Mohs surgery is a precise surgical technique used to treat skin cancer, and basically the goal is to remove as much of the skin cancer as possible with doing minimal damage to the surrounding tissue. So it has a good cosmetic result, and it's ideal for places on the face, mouth, ears, nose, hands, and feet. Mohs, it allows you to check to see if you've gotten all of the skin cancer at the time of your surgery. So you'll know once you walk out of your appointment that all the skin cancer cells are gone. That's Dr. Blattner on the right there. He's checking his slide to make sure that all the skin cancer is out. So Mohs is really great. It has a 99% success rate. And let's see. Other surgical dermatology that we do, we just do excisions of skin cancers. If you don't want to do the Mohs route, we do excisions of cysts, lipomas. That's all I could think at the top of my head. Do we do anything else as far as surgery wise?
Just other types of cysts, pilar cysts, atypical moles on other locations, but yeah, you hit it.
All right, and then cosmetic dermatology, we do injections like Botox, fillers, PRP injections for hair loss in men and women, do microneedling, hydrofacials, chemical peels, dermaplaning, and we have skincare that we sell.
Oh, some Botox.
That's actually going to be in our raffle, so we'll talk more about that later. Other two services that we do, on the left, we do photodynamic therapy or blue light. It's for treatment of precancerous damage, and it's a good treatment to prevent skin cancer. So if you feel like you've had a lot of sun in your life, you have a lot of precancerous lesions, this is a good treatment for you. And then on the right, we have light therapy, and this is for treatment of psoriasis, eczema, vitiligo, and chronic itch. Okay, run through, we have a special going on right now where we do free skin cancer screenings every first Thursday of the month in Lake Oswego and Salem. In LO is with Mark, and then in Salem is with Taylor. So this is important because 1 in every 5 Americans will develop skin cancer in their lifetime. And it's really great if you catch it early, it's important. You can schedule your free skin cancer screenings by calling us or scheduling online. Okay, so this is an upcoming event that we are excited about. We're doing a blood drive with American Red Cross, and we're offering free skin cancer screenings to donors that come by. I think right now, unfortunately, the American Red Cross is experiencing blood shortage. So we're really excited to be able to try to help that and get as many people registered as possible. And we have the link here, but I think I'll share it in the chat if any of you guys want to sign up. And then this is our contacts and scheduling. We do have scheduling online, which makes it easy, but you can call if you prefer to do that. And then that's our Facebook, Instagram, if you want to follow us for any news and specials. And that is the end of my little presentation.
Thank you so much, Adrienne. That's absolutely great. I'm curious, can you tell me more about the blue light therapy and how that works?
Yeah, of course. So you come in and you can expect to be there for about an hour and a half your first time. You'll get, depending on where you're going to get the treatment, it's common on the face, scalp for men. We would prep your skin by wiping it down and then putting a solution on top. That solution sits and soaks into your skin for about an hour. And then we put you under the light for 15 minutes. And so that light and the solution react together and fight off the precancerous damage. And then it leaves you kind of red. It's slightly painful, I would say, not unbearable, but it definitely feels like you're getting a good sunburn.
It effectively gives you a sunburn of your precancerous skin cells. So those cells, just like in a standard sunburn, are damaged and effectively destroyed selectively by the photoactivators. So we're basically giving you a good sunburn.
For example, if you were to do this treatment like on a baby that hasn't had any sun damage, nothing would happen. So it selectively is able to target those precancerous cells. So when you're red and irritated post the treatment, you know that that's the medication working to kill off those precancerous cells.
That was my question. So the solution reacts only with the precancerous cells, and if you had none, you wouldn't be experiencing the burn because it's selectively burning those.
Exactly.
Absolutely.
Great, thank you. I saw that Amy had her hand up. Amy?
Oh yeah, I was just wondering, my daughter has eczema. Is that something that you guys do there, a therapy?
Absolutely.
Absolutely. There's amazing treatments for eczema now, depending on the degree of her disease. And our UVB light box that we showcase is amazing in treating that as well. That's harnessing a narrow band of UV lights that has an anti-inflammatory effect, and it's amazing in the treatment of eczema that's hard to control, in addition to many other options we could offer. So yes, absolutely, bring her in.
Yeah. Oops, I was just wondering, like they always give her these cream things, do you guys, is it more of what you were talking about with the ultraviolet? I mean, is that one of the...
In addition to with eczema, you have to essentially, it's the way I like to term eczema is like you have leaky skin for various reasons. And so the whole goal of eczema treatment is to try to reinforce that skin barrier. The creams are definitely part and parcel of that. And the light is another treatment option that can hopefully mitigate, because nobody likes to put on tons of creams all the time. And there are literally injectable treatments that effectively cure eczema if it comes to that. You've heard of like biologic treatments. There are these targeted molecules that literally take out like one part of your immune system to facilitate disease control. There's a drug called Dupixent. You've probably seen it advertised on television. It's essentially a side effect-free treatment for eczema. The worst side effect, I guess, is you're giving a kid a shot. But if push comes to shove, there's that out there. But it's a spectrum, and we try to find where someone is on that spectrum and offer them the appropriate treatment.
Depending on severity.
Yeah.
Yeah, thank you very much, because it affects her, pretty bad. She's had it her whole life, so maybe an injection would be good. Thank you so much for that.
Yeah.
So again, this is your chamber at work connecting you, Amy, with the resources you need. There you go. You guys are very popular. We have several hands up. I'm going to call on you in the order that I saw them appear. So we'll begin with Katie, then we'll move to Catherine, and then Neil. So Katie, what is your question?
So good morning, Clear Choice Dermatology team. I have a weird question that's probably less weird in your line of work. Given COVID and the increase of masking, I'm sure you see many people with the maskne now. And I wondered if you all are differentiating between maskne, like actual acne, and perioral dermatitis, if you've seen differentiation or uptick in any of those things. And if you could speak to that, if you have treatments too for any of those things. I'll put my hand down.
I've seen a lot of perioral dermatitis lately. I think that the masks definitely are influencing that, just with having your mask on, increased humidity. But I definitely have seen an uptick in perioral dermatitis over the last few months.
Absolutely,
for sure.
both kids and adults. It's like an epidemic.
Yeah, and a lot of the differentiating is based upon where it's located. So around the mouth, around the nose, around the eyes, there's perioral dermatitis and there's periorificial dermatitis, which is a bit different from acne itself. Yeah, it's very, very specific based upon the patient's case.
And they're treated differently, so it is important to have like the recognition that it's periorifacial dermatitis. It's like a little red bump versus acne, which is more of the classic pimple or pustule. And so we want to make sure that we treat, although there is some overlap in treatments, we could do the, the nuclear bomb approach, but we try to individualize treatments. Also just mask hygiene, making sure, with kids particularly, people have their favorite mask, but you got to put a clean mask on every day. There is a role, particularly in dry sensitive skin, to put a moisturizer on, clean your face, moisturize, clean mask. But yeah, it's maskne is a thing.
And from maskne, we'll segue to Catherine. Catherine, would you like to unmute?
Hello. I put in the chat that I did that blue light therapy. I've had it, I think, twice, and that was because of all the precancerous cells. It's pretty painful. Is there any, I swore every time I've done that I would never do it again. It was so painful. Is there any other, are there other procedures that, yeah.
There are different ways.
Go ahead.
Sorry, we're going in and out. There are different ways to treat precancers. We often talk about the face or the area that we're treating as a garden. So if you think of your face as a garden, when you come in to see us, we can often see your weeds or your precancerous cells that we can visually see clinically. But we talk about blue light therapy as a field therapy. So what we're doing is by painting that medication on your whole face, we're able to target the areas we can't see as well. So we call those, we're treating your seedlings as well. So by doing the blue light, you're doing something more preventative. If you just wanted to have the spots that we can see treated, they can use cryotherapy or liquid nitrogen. And then there's also an alternative approach called Effudex, which is a topical chemotherapy agent. It can make your skin red, raw, and itchy, a bit irritated for several weeks as well. So it we usually just often talk about the risks and benefits of both of those treatments.
There are other yet less utilized topicals as well. If you've heard of Voltaren, probably for arthritis treatment, it can be used topically for the same condition, but it's a 6-month treatment. And most people don't have the patience to be applying creams for 6 months, but that is probably a less painful option other than it's 6 months of treatment. So those are more obscure treatments. We usually just say you got to pay up front or pay later.
Right. Hey, thank you so much. I had a second question, but it's just regarding insurance. Have you found that you've been able to run most of your things through insurance? We've had I don't think a lot of dermatologists around here that are very effective at making sure the insurance is pre-approved and covered. And
I feel like we're really good about that. The only one that we honestly have trouble with, Kaiser, because Kaiser doesn't let anybody go out of Kaiser in general. And then Providence at our Lake Oswego location has kind of boxed us out. But in Salem, we essentially take everything except for Kaiser. Yeah. So, and we generally will look at your insurance and make sure that, and we try the best of our ability, even when you're in the office, if we're like recommending, hey, let's freeze this, we try to make sure that that's covered before we do it. Nobody likes a surprise bill.
Perfect. Thank you so much. And Neil, you have a question?
So much for being here. And I know this might be out of bounds a little bit, but you say like the skin is a garden. My hands are like a worm bin. They're disgusting. For 35 years, I bit my hands, right? So COVID stopped me from biting my hands. And for 2 years, I have not bitten my hands, but like bitten nails mess with cuticles. Problem is that I think the damage has been done. I went to get a manicure and they rushed me out, said, "Oh, Dios mío, get out of here!" Like they were not salvageable from so I think I've done some underlying damage to cuticle line, hands. Is that something that a dermatologist? The last time I was at a dermatologist, it was for skin related biopsies, things like that. Do you take care of? Because the only other way, if a manicure cannot take care of this, which it cannot, I'm looking to get into a coma for like 2 months to have like my body just naturally heal this over time. I don't see any other way, but dermatology might be the solution. Have you dealt with really damaged, like super awful cuticles, hands in the past?
Absolutely. There's a number of reasons why, you would be in that boat. Some people are eczema prone and they just have dry skin and it affects
Not
their
me. I am
cuticles.
perfect. I am perfect in every other
You
way.
play with them? Is that what you're saying?
Yes.
So yeah, it's called a tick habit. And so we basically put you in handcuffs and it cures you.
I'm liking this bondage therapy already. Can I?
But truly, we can make some suggestions to help with that. There are even some medications that are used to prevent picking. There's something called NAC. Interestingly, like so many things in dermatology, we use a medicine that's intended for one thing to help other things. So NAC is the antidote for Tylenol overdose. But what they found in the psychiatry field is people that had these extreme disorders like pulling their hair out or gouging their skin, due to anxiety, they take this Tylenol antidote and it quells the desire to pick and scratch. So that's honestly something that you could experiment with. And then if you just need to heal the areas, we can definitely aid in that and give you some suggestions along those lines. But yeah, ultimately the goal is to stop the habit.
So I've culled a lot of that, the habit. It's just the damage. It's like trying to grow in a field that's been acidified, like it's been living in cat urine for like 40 years. It's like nothing's growing in it. So as I said,
on where the damage is, like if there's damage in the matrix, which is down at the bottom of the nail, that's when it will continue to kind of grow out wavy and funky. So we're able to look at it under the dermoscopy and see what we're able to clinically see.
An extreme treatment would be the Dr. Blattner, who's skilled in this, could literally remove your fingernail and try to regrow it kind of like clean slate, which is maybe not the most appealing treatment, but it is potentially something that you could consider. But if there's truly damage deep in that matrix in the nail bed that generates the nail, it may be truly permanent, but that would be probably an extreme measure that is an option.
I do like that we've gone with handcuffs and the removal of fingernails. This
I know, right?
Very
Yes,
interesting.
yes, yeah.
This is probably one of the best. Thank you.
It sounds
It's
like
generally a
Neil
pleasant
can
experience with the dermatologist, trust me.
sounds like Neil can visit you directly and take that up with you guys offline.
Yeah.
We did have one question in the chat that was also answered in the chat, but I want to make certain that Lisa saw that. Lisa asked a question about the light box helping with chronic itch, and Adrienne did respond to that. Did you see that, Lisa? Great, fantastic. Do we have any final questions for our Clear Choice Dermatology team? All right. Well, thank you all so very much. It's been informative, and you can tell from everybody's engagement that they have lots of questions. And so, as Liz said, please do put your contact information in the chat line, and we all know how to copy and paste that, so we have everybody's information afterward. At this point, we're going to take a moment and say, Liz, what kind of announcements do you have for us?
Well, I will tell you, it will be a Chamber of Commerce Day in Lake Oswego as soon as that sun comes out today. Absolutely thrilled to tell you that on Friday, March 4th, we will have a special evening networking at Tumwater Vineyard. Please watch the emails for more information. It'll be from 5 to 7 p.m. So there will not be morning networking that very one morning. Want you to know we are still walking out to our businesses to distribute emergency plans. So if you would like to join me on walking and talking with businesses, letting them know that the city and the chamber has put together emergency planning documents, we are having a great time talking to our local business owners. Want you to all start thinking about when the state says we can remove our masks, because we will be sending out information that says what you as business owners can do if you want to go not have masks, or if you want masks to protect your employees. So just watch for that information. I know you all get it from the Oregonian and every place else, but it's good to start thinking now before it happens. The Trainers Club starts their challenge next week. You can call them for more information. The legislature's in session for the short session for a month, so watch what's going to be happening with your businesses there. And the chamber will be featuring candidates for the Clackamas County Commissioners at a forum on Thursday, March 10th. And this event is sponsored by Northwest Natural. It will be virtual. Thank you so much, Christopher. We'll turn it back to you for the remainder of networking.
Thank you very much, Liz. Now, I know we have another new person on the call. So is there anybody who this is their first or second networking with us? I've got Heather's hand up and Ashley. Ashley, I thought you might be new. So this is your chance. We're going to give you a minute or two to introduce yourselves and let us all know what you do and what brings you to the Chamber of Commerce today. We'll start with Heather.
Excellent. Yes, so my name is Heather Graves Ramsey. I'm with the Coach for Me, and I do executive coaching and leadership development with an amazing clan of coaches all across the country. Mostly working with people that have employees 25 to 400 coming in and doing one-on-one coaching as well as team development. So setting the vision, getting realigned. A lot of folks are unaligned right now. So just having them have some conversations to get back on the same track. And then also doing leadership development programs. So bringing cohorts of individuals through, trying to gear up for a lot of retiring folks that are happening. So to really help those people step into those positions with the most confidence and impact possible. Just moved here about a year ago, and I feel like I've been in COVID cobweb land. I have moved a lot, but definitely this has been one of the more challenging ones to kind of dig in. So I'm here at the Chamber today to just really get to know folks and to start digging into this community, because I feel like I'm missing out on these fabulous people. So thank you for having me.
Absolutely, Heather. Thank you so much for being here. We welcome you to the community, and we hope that Lake Oswego exceeds your expectations.
I think it will.
Ashley?
Hi, I'm Ashley Krause, and I just want to thank Emma Burke for inviting me today. So I live in Lake Oswego. I formerly was a teacher in Lake Oswego. I have kids in the school district, but now I'm a senior living advisor. And so what that means, I'm not talking high school seniors, I'm talking seniors that are 60s and above. And I was a free service. I meet with families and I help them kind of sort out what their next steps are. Maybe it's independent living in 5 years. Maybe it's a situation where one spouse needs memory care right away. Or maybe it's assisted living. A couple wants to move in assisted living. And so what I do is I find out what's important to them as far as location, financially, what would be reasonable, and then even just down to aesthetics of the building, social activities, whatnot. And so we take all that information, and then using my connections of these different communities, I'll put together a list of places that they might be interested in, and then I take them and we go tour. So I feel like I'm kind of using all my skills as a teacher, like social worker, counselor, real estate. It's an absolute joy. I got into it because my mother-in-law was in this situation. So that was kind of my segue from teaching to working with seniors. And I just realized there's this need out there. I was helping her full time and I had nobody. I knew nothing about Medicaid or about spend downs, or I knew nothing. All the acronyms, ADLs, activities, daily living, knew none of that. And so I got into this field and worked in memory care and assisted living, and then got into advising. And again, it's a free service, so that kind of makes families, I guess, feel a little bit better too, that they're not having to pay me hourly. The way I get paid is wherever somebody moves, I get a referral fee, basically. And it's pretty much the same everywhere, so it really doesn't matter to me. It's just as long as that individual or couple or family is happy and